Hi guys, welcome back to another video of Edge channel. So today we will be discussing about edema and coma. So first of all, edema. Edema refers to the swelling of soft tissues due to abnormal expansion of interstitial fluid. We are all familiar with this definition. So edema is just the swelling of soft tissues due to abnormal fluid content. So accumulation of fluid in the interstitial space occurs as the capillary filtration exceeds the amount of fluid removed by lymphatic drainage. Whenever the capillary filtration and the lymphatic drainage is in an abnormal condition, the edema will be resulting in. So edema can be generalized, and causes of edema, like edema is caused by a variety of clinical conditions like heart failure, renal failure, liver failure, or due to some feeding of excess salt, hypoproteinemia, increased vascular permeability, or decreased lymphatic drainage. So these are all causes of edema, and they can be generalized like anasarca, or organ specific like pulmonary edema or cerebral edema like. So moving to the types of edema, there are mainly three types of edema. That is peripheral edema, pulmonary edema, and cerebral edema. So moving to the first one, that is the peripheral edema. This affects the limbs and the subcutis mainly. So signs including swelling, puffiness, and the picking on pressure, and difficulty in moving the affected part of the body will be the main causatives. Examples such as limb and subcutaneous edema in kidney failure or jowl edema in blood-sucking intestinal parasites in rodents. That is mainly the hemococcal we are finding it, osteoarthritis, etc. So udder edema, scrotal edema, or edema in vagina after difficult parturition, etc. So edema of tissue is palpable and subcutaneous edema in nature. So a generalized and pronounced swelling of the body due to accumulation of fluid in the subcutis is referred to as anasarca, and we are all familiar with the anasarca condition. Now moving to the pulmonary edema, excess fluid collects in the lungs, making the breathing difficult. Surface tension will be destroyed and the pulmonary surfactants will not be much active, and thus the breathing will be in difficult condition. So this can result from either congestive heart failure or acute lung injury. So next is actually the cerebral edema. This occurs primarily in the cerebrum. So symptoms include head tilting. The perfusion to the brain will be lost due to the edema and expansion of the fluid vessels. So change in consciousness, mental state, mental stupor, nausea will be there. Even vision loss will be there, nystagmus, etc. So it's very common in case of polioencephalomalacia and in many poisoning conditions. So treatment actually depends upon the cause of edema, and the other therapeutic options like including of diuretics so that excess fluid will be lost, restriction of sodium intake so that hyponatremia will not cause this condition, regular exercise, and topical application of magnesium sulfate glycerin paste such that the excess fluid will be lost. So moving to the next condition, that is actually coma. So what is the definition of coma? So coma is a state of unresponsiveness from which the patient cannot be aroused. So the eyes are closed and do not open in response to any stimulation. So impaired consciousness refers to a similar but less severe disturbance of consciousness. So why this coma is happening? So alertness is actually maintained by the activity of the cerebral hemispheres and the reticular activating system. So alertness is completely lost in the case of coma, such that any important damage to the cerebral hemispheres or the reticular activating system will completely result in coma. So the impaired consciousness involves either of the two mechanisms, that is dysfunction of both cerebral hemispheres or the dysfunction of reticular activated. So the causes that may be structural, that is due to any injury, that is brain injury or tumors or infections, or it will be non-structural, that is toxic or metabolic disturbances, that is mainly happening in poisoning cases, metal poisoning, toxicological poisonings, hypoxia, diabetes, and maybe also in the epilepsy condition. So damage may be focal or diffused condition. So moving to the clinical signs, the associated with coma are non-responsive to painful stimuli. Even whenever we are applying very painful stimuli, the condition or animal will be completely non-responsive. Dilated, pinpoint, or unequal pupil size. Eyeballs may be fixed or exhibit movement, like they'll be having abnormal movements or abnormal breathing patterns, bradycardia, hypotension, hemiparesis, or flaccid paralysis. So it cannot be confirmed by any laboratory test or imaging studies. So neuroimaging is actually used to identify the coma and the causes of coma. And there are many small laboratory tests to identify the cause of coma, but we cannot like completely confirm it by imaging study or laboratory study. We can go for the clinical signs, the tentative sign, and we can go for experience of the surgeon. So treatment, that is immediate stabilization and specific management of the cause, removal of the toxic agent, proper ventilation of the animal, and enteral feedings like adjunctive treatment include passive range of motion exercises, measures to prevent ulcer formation, proper diuresis will be maintained, proper brain perfusion should be maintained, etc. So thank you.